Hello, my name is Hidayah, and today I'm going to talk about the preoperative epicrisis for the case of varicose vein. And so, patient's identification, the date of operation is on the 20th October 2023. Patient's name is Kidir, and he's 55 years old, weighs 95 kilogram, and height is around 170 centimeter, and he's male. So the final diagnosis we have done is the second degree chronic venous insufficiency with primary varicose vein, superficial venous thrombophlebitis, and the classification is C4 for hyperpigmentation, edema, and varicose vein, and P for primary, S for superficial, and also T for thrombosis. And so previously, before doing the surgery, we have already provided medical treatment, and this includes infusion of normal saline, providing with anticoagulant heparin, ibuprofen to help ease the pain. Patient was also given compression socks and also insertion of catheter to record for urine output. And so the procedure that we're going to do is the ligation of saphenous femoral junction, also known as crusectomy. So this is where we're going to ligate the superficial vein in which the thrombus is there. So we're going to ligate the vein to prevent the thrombus from growing into the deeper vein. And the indication for this is life-saving because it prevents further progression of the disease into the ulceration and deep vein thrombosis. As for this patient, there's no contraindications. For the risk of surgery, patient has a high risk of blood clotting, so we will be giving them anticoagulant heparin to control the risk of blood clotting. The risk of bleeding is also high due to anticoagulant, so we're going to provide the patient with fresh frozen plasma. The risk of thromboembolism is also high, since the patient will be lying on the bed for quite a while during surgery, as well as because of the aggregation on the site of surgery, which will provoke the formation of thrombosis. And the risk of infection is quite moderate, so the overall risk here is quite high. And the type of anesthesia that we're going to give the patient is local Novocaine block.